In New Orleans, nothing can escape the hot, humid climate.
Wish I had a dime for all the time I've gotten rain on.
In this lush, steamy paradise,
we do have encephalitis in the area.
an incredible variety of exotic plants thrive.
I never dreamed I would be the 1 out of 5 million, and I was.
Some are healing.
It's rich in sulfur.
Others can be lethal.
I was scared to death.
Insects, fish, plants, part of the cycle of life and death.
Can you feel this?
I mean, I cried for 3 days when they told me I had this.
And the checks and balances of Mother Earth, living together in the perfect harmony that is nature's way. The backwoods of Louisiana are part of nature's pharmacy. More than 600 plants indigenous to this region have medicinal properties.
And I tell you, it's very good. It's a succulent plant.
Which is why 220 miles north of New Orleans,
You know, you could just, and this is what's called an herbaceous plant, meaning you can do.
John Vincent is hunting for herbs.
This is ragweed, and it's a very good blood cleanser. It's astringent properties.
Healing herbs.
A lot of people know the name of blackberry, and they recognize.
John is a tribal herbalist
The root is a very good medicine. Now, I'm going to try to.
who's keeping up the tradition of his Choctaw Indian ancestors.
Hey, the key to health is cleaning the blood, a healthy.
John makes his living as a medicine man without any formal medical training.
Folk medicine evolved into a full-time thing for me when, first of all, I learned about the happiness it can bring into the life of a person who's living with a sickness with no hope of cure.
Growing up, folk remedies, not prescription drugs, were the norm.
This plant will totally repair itself. And,
Like corn husks to sweat out the measles when he was a boy.
a nice sharp knife.
For the past 25 years, John has been using the same 400-year-old healing methods.
I collect most of my herbs and woods like these. You know, this is South Louisiana.
Practiced by his great-great-grandparents.
If I'm going after palmetto or salt palmetto, it grows in, you know, swampy type woods like this that hold a lot of water.
So, 2 or 3 times a week, rain or shine, John heads to the hills.
If I'm going after sassafras, then I'm looking for some healy land up in central and north Louisiana.
The humid climate and marshy terrain in Louisiana create the ideal conditions for cultivating thousands of different medicinal plants.
The uses of folk medicine are very effective in preventive medicine.
Once he's found what he's looking for, it's on to cleaning, separating, and processing.
Then I take them to my wash tank, my wash area. Just like you do any food, you wash it before consumption.
John's patients are mostly people who say they failed to find relief in traditional medicine.
Anyways, I've got some fresh herb here too. This is breastweed here.
So now they're looking to nature for a cure. 53 miles from New Orleans in Ponchatoula, nature's way has done more harm than good in the life of Patty McGeehee.
You ready to go in? On Friday night, the 9th of July, 1999, I felt weak. We were supposed to go out to eat dinner with friends, and I told my husband I didn't feel up to it, which I didn't really understand why at the time.
For this 47-year-old mother and schoolteacher, the problems began with a mosquito bite while digging a hole for a lily pond in her backyard.
So I kept continuing to work and be bitten over and over and over again and just, you know, kept swatting them.
Within days, she began to feel unusually fatigued. This was something far more serious than a simple bug bite.
I went to bed at a reasonable hour. I got up around 8 o'clock in the morning and puttered around the house, but by noon I felt really tired.
Patty spent the next 7 days in bed, semi-conscious and incoherent. By the end, she couldn't speak at all.
On Monday morning, my husband went down to New Orleans to work and called me on the phone, and when I answered the phone, I couldn't speak. I just made some groaning noises into the phone, and he went, "Oh, she's really got a problem here."
With a temperature hovering above 104 degrees, Patty was raced to the emergency room at Oxnard Hospital in New Orleans.
The last consciousness that I recall having was Dr. Young asking me, you know, can you tell me your name? And I was sitting in a chair in that office, and I don't remember if I even answered her.
When we saw Patty, she was very disoriented. She couldn't follow any commands.
Dr. Julia Garcia Diaz, an infectious disease specialist at Oxnard, was one of Patty's doctors. She quickly recognized the symptoms. Patty had contracted Eastern equine encephalitis, an extremely rare mosquito-borne virus that causes severe inflammation of the brain. Few can survive it.
And there's usually very high fever, disorientation and confusion. It's a different type of virus, and out of all the encephalitis that are currently present in the United States, that's probably one of the most severe. It's very debilitating from many standpoints, 50 to 75% mortality rate as compared to some of the other ones, which are, the mortality rate is not as high as Eastern equine is.
Mosquitoes thrive throughout Louisiana because of the tropical conditions. And according to Don Wesson, a medical entomologist at Tulane University, an abundance of stagnant water compounds the problem.
Here in New Orleans, it's a big problem because we have all these big live oak trees that are always shedding their leaves, and they clog up the rain gutters, and mosquitoes love to breed there.
Researchers at Tulane's Tropical Medicine Department estimate that only 1 in a million mosquitoes carry Eastern equine encephalitis. It is so rare, there are no drugs or antibiotics to treat it. And that meant Patty McGeehee would have to pull through on her own.
So the only commands that she could follow at the time probably was opening her eyes and closing it on demand.
Patty's condition took a dramatic turn for the worse when she fell into a coma-like state. Her doctors had no way of knowing what might happen, or when. "82 miles from New Orleans, in the city of Baton Rouge, there's a place known as Carville. And a man known only as Manlow.
Okay, so you really have a hard time with that.
Manlow doesn't want anyone to see his full face or to know his real name. He has lived a lifetime of suffering, not just from a disfiguring disease, but from the stigma that often goes with it. Manlow has leprosy.
You have to set it on a counter or something?
Right.
Hansen's disease affects the peripheral nerves. With the results of the disease, the patients have paralysis of their small muscles in their hands.
Manlow first came to Carville, now called the Gillis W. Long Hansen's Disease Center, 5 years ago for treatment. It is the last inpatient facility in the U.S. devoted exclusively to leprosy, or Hansen's disease. Some victims, like Oscar Dempster, live at Carville.
His shoes are an example of something made at Carville.
Hansen's disease is a chronic infection caused by a mycobacterium, M. leprae, which is a cousin of tuberculosis.
You need to check your mail.
Hansen's is a non-contagious bacterial disease that attacks the nervous system, slowly diminishing the skin's sensitivity to pain and temperature.
Okay.
It causes skin rashes and eventual disabilities that result in deformities. In the United States, it is most prevalent in Texas and Louisiana.
Probably between Texas and Louisiana, there are probably 50 new cases per year in these areas.
Victims of Hansen's disease typically contract the disease from either a family member who is undiagnosed and untreated, or from an armadillo.
We have a stuffed model of the 9-banded armadillo. In Texas and Louisiana, there's a percentage of the armadillo population which naturally have leprosy as an infection, and it is possible that due to contact with armadillos, particularly consumption of armadillos, that a person may have the infection transmitted.
Bye, Cherry.
Bye.
Manlow contracted Hansen's disease 24 years ago, although the doctors aren't sure how. By July of 2001, he'd lost sensation in both his hands. 7 weeks ago, he had surgery on his right hand. Today, he's having surgery on his left hand.
The operation, what it can do is it can take and pull his thumb up like this here so that he can pinch over to his fingers more.
A few hours from now, Manlow will undergo surgery on his left hand
Pinch for me again.
in an attempt to restore movement in his semi-paralyzed fingers and to overcome the damage done by nature's way. New Orleans has a reputation for great food, and even better, fresh seafood that's fished out of the Gulf of Mexico every day. Creative variations of crawdaddies, catfish, or raw oysters appear on virtually every restaurant menu in the region.
6 for 12, dozen and a half dozen.
But sometimes,
I was scared to death. Scared to death because I didn't know what to do.
the food makes people sick.
Hi, sweetie pie. How are you today?
He could not breathe. It was shallow breathing. His heart rate had dropped. And the physician on duty in the emergency room said he was in septic shock.
Are you in any pain?
In September, Godfrey Bergeron ordered raw oysters at a restaurant in Lafayette, 135 miles from New Orleans. Within 24 hours, his wife Lydia noticed something was wrong.
I walked in, looked at him, and he had little black marks. It looked like little, I guess about the size of a dime.
Do you want this arm covered?
3 days after eating the oysters, Godfrey couldn't breathe. Lydia rushed him to the emergency room at the Medical Center of Southwest Louisiana, where doctors diagnosed Godfrey with a severe case of Vibrio, a dangerous bacterial infection caused by contaminated seafood.
What, baby? I didn't know anything about Vibrio. I had no idea. I didn't know how dangerous it was until the doctor started telling me.
Despite warnings from the FDA about potential dangers from raw oysters, people in New Orleans can't get enough of them.
Let me just take some of this off.
I was born and raised here in Southwest Louisiana. I've eaten seafood all my life and had no idea, you know. I mean, I love oysters.
Vibrio is a seasonal bacterium in the cholera family that thrives in the warm, salty Louisiana waters, particularly between the months of June and August.
It's more common at this point of the country just because you're close to the coastal areas and you have much more seawater exposure and seafood ingestion in this area of the country.
All right, here we go.
Vibrio infects 1 in 20,000 people, often people who've eaten contaminated raw seafood. There are 2 strands of the disease, one more lethal than the other. From 1996 to 2000, 85 people in the Gulf states died from their infections.
One is a serious wound infection that can lead to severe trauma to the tissue requiring amputations. The second form of illness, it can cause what's referred to as septicemia, or a profound, overwhelming bacterial infection that can lead to death, and it has a very high mortality associated with it.
Godfrey Bergeron was diagnosed with the second, more deadly strand of Vibrio.
You okay?
His infection began with blisters on his skin. Then it started to eat away his flesh.
What you have exposed right now is mainly muscle and tendons.
Initially, at the time of his presentation, he had merely a couple pinpoint lesions on his hands. Within 24 hours, however, he had what's described as hemorrhagic bulla, these large purple blisters, which were most prominent on his left shoulder and both lower extremities.
What we're doing here is just soaking these dressings with the Burnell solution.
When he arrived at the hospital, Godfrey was suffering from septic shock and very low blood pressure, just 70/30. His prognosis didn't look good.
My first thought was, well, fear. We had never heard of anyone who had survived it.
The first 24 to 96 hours were very tenuous. At the time of his presentation, we actually did not think his chances for survival were all that good.
3 days later, doctors confirmed Lydia's worst nightmare.
You may as well resign yourself to the fact he's not going to make it beyond today.
He's a medicine man without the MD or formal scientific training.
I concentrate upon the herbs that I grew up with, that I was taught when I was a child. The herbs that are indigenous to Louisiana: elderberry, poke salad.
He doesn't fill prescriptions. He sells herbs instead.
But here I have echinacea that's growing here now.
Tribal herbalist John Vincent supplies his clients with the homegrown variety.
I don't treat people. I do wellness counseling.
In 6 herb shops, like this one in Baton Rouge, Louisiana,
Okay, we got everything in one piece here.
John Vincent dispenses what he and his patients believe are healing herbs.
And in this package here, we got vervain. Vervain is good for people who suffer with a lot of nervous tension.
While all herbal remedies are not FDA approved,
It's rich in sulfur.
many pharmaceutical companies include natural herbs in alternative medicine products.
Yeah, but many times these people have gone to hospitals and doctors, okay? And a lot of times they come to an herbalist as a last result. This whole package
Before John advises clients, he always asks them to consult with a traditional doctor first,
Hey, it's good to see you there. How you been? Hey, just great.
like Dr. James Hines.
Look at this big peel I brought to you.
Dr. James Hines is a general practitioner in Baton Rouge.
I need you to prepare me a posters of this because I have a patient I'd like to use it on.
Who's been working with alternative medicine practitioners like John Vincent for over 20 years.
Multiple medical problems, but what she's suffering with most now is advanced arthritis in her left knee.
He has a patient he can't cure.
Poultice, you couldn't select a better approach.
Poke root's consistency resembles that of a carrot's. Its leaves are typically cooked and served like collard greens.
When this thing is applied, and by the way, we slice it up in some thin pieces like a carrot.
More often, poke root is used as a folk medicine tonic to treat arthritis and rheumatism.
That person is going to feel a whole lot better.
John and Dr. Hines are about to attempt to cure a patient's crippling arthritis with an age-old herb remedy that Vincent learned from his tribal ancestors. Because of a single mosquito bite, schoolteacher Patty McGeehee is a statistic.
And I never dreamed I would be the 1 out of 5 million, or 2 out of 5 million, and I was.
In the last 2 years, only 2 cases of eastern equine encephalitis have been reported in Louisiana. Patty was one of them. And even though the disease is found in only 1 out of every 5 million people, it has a mortality rate of 50%. 5 times as high as the more common West Nile virus.
I was terrified because I had enough background in science to know that it was a devastating illness that many people did not recover.
When Patty was first diagnosed, she spent 7 days in the acute care unit at Oxnard Hospital.
I was like laying there going, oh my God, I may never walk again. Oh my God, I may never be able to sit up in the bed. Oh, you know, I was devastated.
The profound effects of the disease left her unable to work because speaking and moving were difficult. Simple things were no longer simple.
One of the first things they had me do in the rehab was to walk some stairs, and it's still one of the obstacles I have because I can't go up and down without holding on anymore.
2 years after being hospitalized, Patty still lacks total coordination.
I'd have to walk up and down, and we'd go in a big circle, and I would walk up and down, and it was really very difficult to do. And I haven't really quite mastered the stairs after all.
Patty staked her hopes on staff physician Julia Garcia Diaz,
Hi, I'm Patty McGeehee. I came to see Dr. Garcia.
who started her on an aggressive course of rehabilitative therapy.
Hi,
I finally get to see you again.
It's been a long time. She couldn't speak, she couldn't utter any words, and she couldn't respond, and she couldn't follow any commands as far as from a standpoint of raising her, as simple as raising her hand. So she was not able to do that.
The disease left Patty with multiple problems. Muscle spasms made it difficult to move, and her short-term memory was practically destroyed.
Try to hold this one for me now. Don't let me pull. So that
Eventually, medication subdued Patty's muscle spasms, but only through therapy could she hope to one day regain her memory.
And so I'm going to give you 3 words, okay? Table, flower, and blue. Can you repeat those back to me?
Table, flower, and blue. I could do that really well now.
Okay.
But it wasn't like that when I first
It wasn't
got
that
home.
easy when you first
No.
did it.
I wound up carrying a notebook around, and I wrote everything down because I would forget it.
Short-term memory loss is common with the disease. Patty's had deteriorated to the point that she couldn't remember what she'd done 5 minutes before.
Could you tell me those 3 words I gave you initially?
No.
Even after 2 years of rehab, she still has trouble remembering simple words.
I think blue is one of them.
Blue was one of them, and you got 2 more that they were up.
And it's possible that her memory might never fully recover. But Patty's determined to return to teaching and to overcome the odds stacked against her. Three days after being admitted to a Lafayette hospital, Godfrey Bergeron is lucky to be alive. His doctors feared the worst after diagnosing Godfrey with a highly dangerous bacterial infection called Vibrio, caused by tainted oysters.
Sweetheart, listen now. You know this afternoon they're going to take you and bring you into surgery, and it's going to...
But he's made a miraculous recovery, thanks to antibiotics, fluids, and being put on a ventilator.
Considering his medical status, it's pretty remarkable. He healed great, so, you know, I'm optimistic.
The infection caused serious tissue damage to Godfrey's shoulder, hands, and legs.
We're taking him back to surgery today.
Couple of bumps, Mr. Bergeron.
Today, Godfrey is undergoing his 6th surgery to graft new skin onto the damaged parts of his body. His hands and shoulders have already been grafted.
Couple more bumps, Mr. Bergeron.
And now his legs are finally stable enough to withstand the same procedure. They hope it will be his last.
Now, when I was first asked to see the patient, he was in the hospital about a week. And, I mean, he just had black extremities, just, you know, frank gangrene of tissues.
Dr. Ken Odenay will perform the grafting surgery,
Relax this arm.
which will help protect Godfrey's exposed tissues and bone. It is a graphic and difficult procedure to watch, but one that Godfrey desperately needs.
Everything you see here was black and had pus draining, as well as his shoulders and his hands. I guess I'll start on this side. The tissues are markedly improved from...
Dr. Odenay begins by removing the dead tissue from the damaged part of Godfrey's leg.
At one point, everything you see here that's red was all black. It was just totally dead.
He'll replace the bad tissue with skin harvested from healthy areas on Godfrey's body.
What we're about to do now is start harvesting skin grafts. It's called split-thickness skin grafts, where you're not taking the full thickness, you're taking essentially about the thickness of a sheet of paper from his thighs. This is some areas where we harvested grafts last week for his shoulder and his hands. This is a dermatome.
A dermatome is a big shaver that harvests Godfrey's skin in the appropriate thickness.
This is pretty standard for harvesting what's called a split-thickness skin graft. Skinny legs makes it a little more cumbersome. Okay, let's start with that. What we're doing back here is meshing the skin. You can mesh to different volumes, and we're meshing to 1 to 1.5. So essentially, you're able to use the skin for a greater volume.
After measuring the area where Dr. Odenay is going to insert the graft,
This is the skin graft. We take it off the carrier and lay it on there, and you can see it's meshed. It's got like lattice work.
he staples it in place. With the right leg grafted, Dr. Odenay repeats the same process on Godfrey's other leg.
All right, Got it all covered with graft. Now we're just going to put big dressings on it.
Nylon mesh gauze laced with antibiotics helps Godfrey's legs fight infection. Splints immobilize everything, so the grafts will take.
Because you can do everything else right, and if you don't have a good dressing, you're almost guaranteed failure.
In about a week, Godfrey's dressings will be removed, revealing his new skin for the first time. This woman's hands and feet are numb,
I need to wear a hard sole shoe.
swollen from the ravages of Hansen's disease, also known as leprosy.
I need to wear them because I could step on tack, a nail, anything, and be bleeding for a couple of minutes before I'd realize I was bleeding.
Okay, I'm gonna have to get you to sign.
She prefers not to be identified. She wants to avoid the stigma that leprosy still carries. Many people incorrectly assume that this disfiguring disease is contagious.
And tell me, can you feel this?
No.
Can you feel this?
She believes she contracted Hansen's disease 6 years ago.
Can you feel?
The first symptoms I had was a rash about the size of a dime.
Do you feel this here?
Yeah.
You feel it on that side, but not the other.
She remembers picking sweet potatoes in a field full of armadillos, a common carrier of Hansen's disease.
You touched the rash, and it was a little numb. And then on my right leg, it had a rash by the shape of a ringworm.
You take your shoes off and take a look at your feet.
Her symptoms grew progressively worse, but she still didn't know what was causing them.
And higher up?
When I found out I had it, I thought I was gone. I mean, I cried for 3 days when they told me I had this.
It does it by invading the nerves and then causing inflammation, which results in loss first of sensation and then finally of muscle strength. So that something simple like being able to feel the Q-tip will be lost. The type of Hansen's that you have, you'll need to take the 3 medications for 2 years every day, okay? Hopefully, month by month, you'll notice improvement. Now,
Hansen's disease is 100% curable through antibacterial drugs.
Quarantine was effective in the past, and certainly improving people's standards of living is effective. But now with good treatment, there's no reason that a person can't be treated well at home, take their medicines, come to clinic, and lead a normal life. The swelling should go down. Like I said, month by month, you'll notice improvement.
Today, tendon transfer surgery can restore range of motion to hands and feet that have had nerve damage.
He can't pull his thumb out like this here.
I gotta stop whenever I can do it.
Like Manlow, who'd begun to lose the use of both his hands and thus his ability to function.
And the tip of his thumb goes down.
Today, he is undergoing a 3rd operation at Summit Hospital in Baton Rouge. The hope is that the surgery will restore movement in his left hand.
More like that. The purpose of the surgery that we're entertaining to do today will give him the ability to pull his thumb over and touch the pulps of his fingers with the pulp of his thumb.
Dr. Ron Matthews expects the surgery will take about 90 minutes.
Are you ready for your operation?
I'm ready.
All right.
Tribal herbalist John Vincent and general practitioner Dr. James Hines are on their way to see Mary Green, a chronic arthritis sufferer.
She's had ongoing progressive osteoarthritis that's been treated with a variety of NSAID preparations.
For the past 10 years,
Okay, finally made it here.
Dr. Hines has treated Mrs. Green at her home
I think I've got about everything I need here.
at least once a month.
You know, it couldn't be a nicer day to pay a house call here.
Her condition hasn't improved, despite pain medication, anti-inflammatories, and arthritis pills.
Good afternoon, Ms. Green. How you doing today?
So today, Dr. Hines has brought John Vincent along to try some of his herbal remedies.
This is John.
It's good to see you.
We've come by to kind of work on your knee today. How you feeling?
Pretty good. I still have pains in my knees.
Okay.
Swollen legs, along with arthritis pain that registers a 5
Can I take a look at it?
on a scale of 1 to 10, prevent Mrs. Green from walking more than 20 feet.
So the pain is starting over here in your hip?
I will try anything that's going to give me relief. Relief is what I need.
John brought some herbs, specifically pork root, and we're going to fix it and apply it to your leg.
Yes.
And we have to take a few minutes and go outside to do that. So kind of bear with us, okay?
All right.
John begins preparing the poultice
Okay, John, what do we have here?
Okay,
by cutting off slivers of poke root.
traditional poke root right there, it's still fresh. Okay?
The poke root works topically by drawing out excess fluid. This decreases the pain because it reduces the swelling and inflammation associated with arthritis.
So would you want to pound this down to like a powder or just so it breaks
Oh
up?
no, it's ready. It's ready about now, yeah.
So what's the next step?
The next step is adding cornmeal to hot water to make a plaster cast.
We're going to get the water that's been boiling on the stove.
It cements the poke root firmly in place once it hardens. An added benefit, the cornmeal has its own medicinal properties.
And the cornmeal plaster helps to increase the ability of the poultice to draw out the pain and the swelling. I'm going to begin to put the poke root in now. I'm going to start underneath.
John packs the poke root and cornmeal plaster around Mrs. Green's swollen left knee.
It seems a little messy, but I tell you, the results that we've gotten with the poultice is well worth it. And then we place the cornmeal on top.
Then he wraps sterile gauze around the mixture.
I'm going to bring my end of the gauze this way. Now we got it.
And an ordinary towel adds extra insulation.
The longer the warm time is, the better it is.
The poultice wrap will stay on Mrs. Green's leg for 24 hours.
That should be nice and warm and comfy, right?
My experience from a case-by-case perspective is that poke root is an effective treatment for at least osteoarthritis. And we're going to come back tomorrow, move that and check on it, okay?
Okay.
The healing pack will come off tomorrow,
Pleasure being here, okay?
revealing the results of John Vinson's natural remedy.
All right.
And maybe even an end to Mrs. Green's chronic suffering.
Take care.
We'd like to know for you, okay?
These beautiful Louisiana bayous disguise a pesky problem wrought by nature's way. Mosquitoes. Some of them carrying potentially life-threatening diseases, like encephalitis. In the 1960s, Louisiana established the Mosquito Control Board to trap and test mosquitoes for infectious diseases.
90% of what I do is surveillance and monitoring.
Field biologist Mike Brody covers 50,000 acres of marshland in St. Tammany Parish. The rest of the state's waterways are monitored by airboats operated in 14 other parishes.
I'm checking on mosquito species, both adults and larval, to determine the density of the population, what the species are, where they're located.
Mike's job is to find and then trap mosquitoes, like the kind that infected Patty McGeehee.
We do have encephalitis in the area, and that's what we're mostly looking out for.
Mike puts himself in harm's way once a week. He canvasses 8 square miles during a typical surveillance, where he's repeatedly exposed to potential disease. So far, Mike's been lucky. He's never been infected.
This dipper represents 1 square foot of marsh. Every dip I take, I'm going to make a count how many larvae I got in that dip per species.
Louisiana's wetlands are ideal breeding grounds for 28 different species of mosquitoes. 27 traps around the New Orleans area yield roughly 2,700 mosquitoes per week. Almost all captured mosquitoes are shipped to a central lab where they undergo tests to determine if they are carrying disease. Others go to Tulane University, to be studied and tested.
Okay, these are all just larvae. I'm going to take the lid off, and you can see some of the little wrigglers, as they're called. Well, really, we're just part of a chain of events that take place to identify a mosquito virus. And we do it to try to find virus in mosquitoes before any humans are infected. Everything's cold, so we're going to have
Medical entomologist Dawn Wesson also breeds her own mosquitoes.
We've got some Culex, some 80s. I won't keep it out too long, but
all of the samples are then frozen to keep them from drying out prior to testing.
The net is full of dead mosquitoes. There's a few other insects in
After
there,
freezing or spawning about 50 mosquitoes, the testing begins.
They'll either put the mosquitoes into a cell culture system, or they'll use a molecular method to try to detect the presence of the virus.
An alternative test for detecting viruses in mosquitoes relies on chickens. Any bird will do, but chickens are the easiest to cage and monitor.
$6.85. Once we bleed them, as long as they're not positive, we'll bleed them all year long, once a week. Once they're positive, we'll no longer bleed that chicken because we already know it's positive. Because once it's positive for the antibodies.
There we go.
After an infected mosquito bites a chicken, the bird develops antibodies but doesn't get sick.
Most diseases are encephalitis, like St. Louis and Triple E. The birds and chickens don't die from the disease. Their immune system is capable of handling the disease. He's pulling the feathers off so that they can get a...
Vicki Taylor is the supervisor entomologist for St. Tammany Parish Mosquito Control. She draws blood from 4 chickens once a week.
When we take the blood, we take a sample of it and we take it to the lab, and then they can identify several different diseases, St. Louis, Triple E, or West Nile virus.
When a mosquito tests positive for virus, the information is shared with the State Office of Public Health, which then publicizes the findings. Insecticide is the last step. Infected areas are sprayed immediately after a virus is detected.
The end goals for the work we're doing both in New Orleans and out in some of the rural areas is to generate risk maps for transmission of the virus. This particular mosquito is really associated...
Dawn is working on a risk map to predict when and where outbreaks will occur.
And so trying to essentially outthink the mosquito or outthink the virus is really very challenging. This again is this yellow fever mosquito.
The long-term goal is to provide people with advance warnings that they might be at risk for contracting a deadly mosquito-borne virus, a task so vital that Patty McGeehee is about to become its most vocal advocate.
You've seen how they dump them over here?
Salt water is in Mike Voisin's blood.
He just takes the bottom off. That's something my dad designed as well.
Oyster farming traces back 7 generations in his family. The Voisins own Motivated Seafoods, an oyster farm and processing plant in Houma, Louisiana. If Godfrey Bergeron had eaten one of these oysters, he would not have contracted the Vibrio that almost killed him.
We're the first installation in the United States of any hydrostatic high-pressure processing of a food product.
Hydrostatic pressure uses 40,000 pounds of water. It's pumped into this oyster-filled cylinder for 180 seconds.
Equipment actually works a little bit like you're washing down your carport at the house. You put your thumb over the end of the hose, creates pressure so you can wash the product down.
The water pressure kills the deadly Vibrio, along with thousands of other benign bacteria in the oysters.
At that point, we knew we developed a perfect oyster. We knew that we had something, and we went about developing commercially for it.
The FDA warns against eating raw seafood unless companies like Motivated follow certain guidelines. But the hope is that more Louisiana oyster farmers will adopt this process and reduce the threat of disease from tainted oysters. Manlow's tendon transfer surgery is about to begin at Summit Hospital in Baton Rouge, Louisiana.
They don't require much anesthesia.
Doctors hope to reverse the crippling effects of Hansen's disease on his left hand.
250, that'll work. Go to the other side. You'll notice that there's a blood pressure cuff on his arm.
The tourniquet on Manlow's left arm makes the surgery bloodless and much easier for surgeon Dr. Ron Matthews to see what he's doing.
Give me a lamp, Doris. So the first thing when we plan an operative procedure, we outline. You got a marking pen, Doris? And an incision's here and here to tie the new tendon to his thumb. Each finger has two tendons, one that works the tip of the finger and another one that just pulls that joint. We're going to remove a tendon from the middle portion of his finger, pull it out.
Using his marks as a guide, Dr. Matthews begins by making a series of incisions.
This incision here will be for harvesting the tendon. This incision here will be for the rooting purposes.
Then he isolates the tendon that will be transferred from Manlow's middle finger.
There's two slips of the next tendon that pulls just the middle joint. So we're going to cut it fairly close to where it goes into the bone. This is one side of it. So this tendon is free now. Pull and put tension on the tendon. By doing that, then the tendon comes out nice and smooth. So we're going to separate these two slips at this time.
Splitting the tendon down the middle allows Dr. Matthews to anchor it to Manlow's thumb in two different places.
So that we can make a tunnel.
The next step is to carve a pathway for the new tendon.
And we'll give it a little turn.
He threads the tendon through to the base of Manlow's thumb.
I got it, Doris, thank you.
And sutures the other incisions shut.
And now the last step of our operation is we're going to take and insert the tendon back around a little pulley.
After Dr. Matthews anchors the new tendon securely in place, he repeats the process higher on Manlow's thumb.
And tying it to this helps hold it out straight, so he'll have to pinch the tip of his thumb, not to that side of his thumb. Drop the tourniquet, please, for me, sir. Irrigate, Doris. And as you can see now, his hand has some color to it.
Removing the tourniquet restores blood to Manlow's arm when the 1.5-hour surgery is over.
It went fine. We harvested the tendon, and we rooted the tendon, and then we inserted it into the thumb.
Manlow's cast will stay on for 3 weeks. After the swelling goes down, he'll begin therapy to use his newly restored hand. Nature's way robbed Patty McGeehee of her mind and body when a mosquito infected her with encephalitis.
Not being able to drive, not really being able to remember everything, not being able to function. And so it was a very long time to where I got back to where I was somewhat normal to do the things I needed to do.
Hey. After a 1-year hiatus,
I came to pick up my roster. A hypothesis, just the best guess.
Patty finally returned to teaching 7th grade science class at Hammond Junior High School in Louisiana.
Now, there's all kinds of ways. And I guess about being back in the job about 4 months, I felt comfortable and not so nervous, and I was able to not depend on other people so much. You know, how do I do this procedure? What forms do I file for this student?
Strength and stamina intact, Patty has become a tireless activist. Last month, the Ponchatoula mayor appointed Patty to run the Mosquito board that she lobbied to create.
We are one of the few locations across South Louisiana that doesn't have any detection program going. And I just felt like this was imperative that our parish get involved in the surveillance of these mosquitoes.
If and when there is another encephalitis outbreak in her parish, Patty McGeehee will be the first one to alert her community and help others avoid the devastation she suffered. Mother Nature became Mother's little helper in the case of Mary Green.
How'd you do last night?
Pretty good.
Any problems?
No.
How's the knee?
Knee feels much better.
Can we kind of take a look at it?
24 hours after tribal herbalist John Vincent and family practitioner Dr. James Hines applied a poultice or compress made out of poke root and cornmeal.
And as we can look at the poultice material right here, where there was once succulent bark, we can see that the bark is now dry.
They've returned to unveil the fruits of their labor.
And tell me how it's changed just from yesterday.
Well, I can bend the leg better than I could yesterday.
So the pain has gone down.
It's helped a lot. So you put your leg down?
That successfully reduced some of the suffering associated with Mary's arthritic knee.
Okay, now yesterday you were telling me if you put it on a scale, the pain was at about 5. Today, where would you put it? 2, 3, 4, 6?
3.
About 3.
Thank you, Ms. Green, for allowing us to come into your home.
The amount of swelling is better. We'll continue to try it, and as long as the patient is improving, we'll continue to use it.
And so hopefully by some...
John will apply the poultice a dozen more times to help Mary on her road to recovery, walking on her feet again.
Where we'd taken the tendon and pulled it out.
2 days ago, Dr. Ron Matthews transferred Manlow's tendon in his left hand,
And he's a little swollen. He has a little...
freeing it from the ravages of Hansen's disease.
And circulation to his finger's good.
It's now healing under the support of this cast.
You come to therapy twice a day.
In 3 weeks, Manlow will begin working with an occupational therapist. Moving his thumb will soon involve rewiring his thinking.
So at the re-education process, he'll initially think about bending this finger, and when he does that, it'll make his thumb pop up.
3 tendon transfer surgeries later, Manlow is on his way to greater independence.
Somebody had to feed you, somebody had to do everything for you. And now, thank God and thank to Dr. Matthews and this hospital I can do everything I needed.
Hi, Godfrey. Hi. What's going on?
Godfrey Bergeron is winning the battle against Vibrio,
Did you sleep well? How about
a flesh-eating bacterium sometimes found in raw oysters that nearly cost him his life.
Prior to that, for about 3 or 4 years, I wouldn't eat raw oysters because of that.
There you go. Let me see the other one now. Yeah, you got a good grip there.
But then I kept seeing people constantly eating raw oysters and enjoying them so much, and I enjoy them so much. I said, don't hear anything, I'll go ahead and eat them.
Next week, wonderful. So if you continue doing rehab, then we can get you home soon?
And in the last year or so, I've eaten oysters at that same restaurant probably 6, 8 times.
With rice and gravy. No, no oysters. Definitely no oysters.
Want to try to take a couple steps, or you want to wait?
Godfrey's recovery begins one step at a time.
Just see at least how I tolerate it.
This is the first time in 8 weeks that he's been able to walk.
Keep pushing. How are you feeling? After watching him for 8 weeks, I just never thought I'd see him walk. Come on, keep doing it for me.
You driving this bus?
I am so proud of you.
The next several weeks are going to be strictly build back up because this brought me all the way down. It'll be strictly exercise and just body management, getting it back to something normal.
Godfrey's doctors expect him to be fully recovered in 6 months, able to reconnect with the natural riches in this lush tropical city
How you feel?
that are part of nature's way.
I feel like my medication's about to kick in.
Yes, it probably is.